Hi everybody, it's Michelle here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content, like what you hear on the channel, please be sure to subscribe. Today's topic is going to be about belly binding. And belly binding is basically the art of wrapping the abdomen or torso area and hips in some type of cloth, woven wrap, girdle, or some form of garment to pull your muscles back together, to pull your pelvis bone and your hips back into place. When we have children, ladies, women, when we have children, sometimes we stretch farther than we should, or just by having multiple children, or gaining a little bit too much weight, depending on whatever your situation is. I know with my middle child, I went up to like 215, and I definitely needed to belly bind. But yeah, it just all depends on what your situation is. But I encourage everybody to belly wrap and belly bind post having a child, because it is a great practice to get you back healing and restore your abdominal muscles and put everything back into place, your organs and all of those great things. So it also addresses diastasis recti, or recti, however you want to pronounce it. It also addresses that as well. I did a different video on how to address that with the proper exercises, gentle, repetitive exercises that you can do to help pull those muscles back together and stop yourself from tinkling on yourself, pull the pelvis back up into place, and just heal. So belly binding is a long-standing practice. It is not something that's new. What happens is, you know, we are raised in Western society, and these things aren't really talked about, or we're not taught. Like, I was in a class recently, in a beautiful baby wearing course, and a young lady said something in the comments like, my doctor told me that it was nothing I could do about my diastasis recti. I just had to get surgery when I was done having children. That is an absolute lie, first of all. That is lazy, it's misinformative, and I think that we have to do a better job, because that was really a drop of a ball, because that woman assumed that she had to get some sort of surgery in order to correct, you know, the space in between her muscles after having children. And that is not true, because what did the people before these surgeries do to address these problems? I can't imagine that they cut their stomachs open and sewed their muscles back together. This doesn't make any sense, right? So there honestly has to be something. I know there is heat therapy. I know there is belly binding. I know there is proper nutrition. I know there is proper exercise. But yes, let's start with belly binding, because that's the easiest and most gentle way to get started postpartum. You can also belly bind during pregnancy in a gentle way, not the tight, you know, snug wrap that you would do afterwards, but you can definitely hold yourself up and keep your baby in a good position before you even have the baby. So I just want to get into talking about the benefits of belly binding, right? So belly binding helps, again, like I said, get those organs back into place. It helps close the gap in your abdominal muscles. It helps with your pelvic floor and your pelvis bones, getting those things back into position, and also your hips. It's good for back pain. It's good to help you sit up straight after you have a baby, so that you're in a good, proper position to nurse your child. It's so many different benefits to it. helping, like I said, the pelvic floor, stay pulled up and not drop so low. And this is where we get pelvic floor dysfunction. This is where we start to pee on ourselves. This is where we start to have irregular bowel movements, all of those different things, because we have not allowed ourselves to heal properly, right? So belly binding can address all of that stuff. You can belly bind right after baby is born. Something that I learned in that beautiful baby wearing course done by my Misi Birth Services was also that you can belly bind right after a C-section. So I didn't know that. I was actually under the assumption that you had to wait a few weeks for, the scar tissue. And I know sometimes people get staples, sometimes people get the stitches. It's different thing. Different doctors do different things. So I was under the impression that you had to wait for a little bit of the healing process, but that's absolutely not the case. I learned that you could do it right away. They actually give you a bind after having a C-section, which I did not know, because I definitely supported a birth that ended up as a C-section. Actually, a couple of births that ended up as C-section, and I never seen them wrap them in a bind. So that was news to me, but I learn something new every day. This is why I love taking continuing education courses. I don't ever claim to know everything. I will sit in on any course, any class. I will read any book. I will touch base with any article, go back to my notes from years ago, because it is always new research, always new information coming out. Always something that I just don't know. And I know that I'm not going to ever know everything, but I love to just continue to learn, to continue to be up to date, to give my clients the best possible outcomes, the best possible information, the best evidence, the best, all of that stuff. So I continue my education no matter what, because I'm not perfect. And sometimes I just don't know. I don't know an answer to something, and I'm always willing to go get that answer, right? So I'm happy that I learned that, because I definitely was wrong and discussed that with one of my clients and said, hey, we need to wait a couple of weeks for you to, to heal a little bit before we tighten you up. And that wasn't the case. So that's something new and great that I learned. But yeah, so all of this is good information to have. You definitely either want to take a course in it, have a doula that knows how to wrap, or YouTube it. I mean, sometimes I know that videos aren't the best way of learning for everybody else, or for everybody. But if you want to, you can look up videos to get familiar. And I do 2 separate binds. So I do Bangkok belly binding, and I also do a crisscross bind. So the type of material that I particularly use is this. So I don't know if you guys can see this, but if you can see the edges, this is called muslin wrap or muslin. I don't know, everybody says it a different way. So this is the wrap that I use. This is 100% muslin material. It's organic, and I get it by the yard. So I think an average size is a 9x12 for the Bangkok bind that I do. So it's basically like stitches each set a group of muscles. It kind of like stitches you back up. But I usually, for an average woman, I usually use about 9 to 12. If you are a little bigger or taller, you might want to go 10 to 16. And you could go all the way up to, to 21 yards, because depending on your size, your weight, your height, the amount of belly you have after birth. So just it all depends. But I try to get at least a 16-yard stretch to, keep in mind every body, but it doesn't always work out that way, because sometimes I fall short. Sometimes I have a bigger person who can't fit it, and I'll have to go out and get a new measurement, or I have a super petite woman and I have too much fabric. So it just depends on the bodies. But I try to do like a mid area so that I have enough wrap too. And I have about like, this was about 8 binds, but it's probably only 4 now because I've been using it. But I usually get enough for about 8 to 10 binds at a time. When I run out, or when I'm at my 2, when I'm at my last 2 wraps, I'll go and re-up on my fabric and things like that. And I'm only just saying this stuff to like kind of give a gauge for new doulas who are coming in, or doulas who are adding belly binding to their service. It's a relatively simple practice. It definitely takes some skill, some patience. It can be tedious with the Bangkok bind. But yeah, I offer the service. I show my clients 2 ways to bind, and make sure they know how to do it before I leave. And I provide the wrap. But that's just the way I do it. It's all different kinds of ways to do it, but it is very much a beneficial practice to help with your healing process, to help you go back to normal, so that you're not sneezing and peeing on yourself, so that you can have pleasurable sex after you are done recovering. All of these different things, because it helps keep you together and pull everything and restore everything back to its rightful place. You can also add heating pads over top of these binds, right? And this helps tone the muscles, first soften them, and then help tone them and get them relaxed so that they can sit back in their rightful place. It also helps with postpartum like blood retention, because sometimes we come out of childbirth and we stop bleeding the next day. And it's then you'll hear the doctor say, oh, like, you're doing so good, this is that, there. But no, we don't want to retain the blood. We want to get the old stuff out. There's a such thing of hemorrhaging, and it's also a such thing of retaining it. So we want to get it out. So heat and warm helps with that, helps relax and tone those muscles. And yeah, you can definitely put the heating pads around the bind, or like not heat. Maybe you don't want to do heating pads because like that's electric and you don't want to fall asleep and you're exhausted, but you could do like warm compresses. So these are all different things and different ways that you can do to kind of help you heal, right? But yeah, that's pretty much my take on belly binding. I think it's a beautiful and wonderful and amazing practice. And yeah, so if you guys have any questions, I hope this was helpful. I'm always available to answer your additional questions. If you have a topic that I didn't talk about that you would like me to talk about, you can reach out to me at birthuhura@gmail.com. But yes, belly binding, it's great and amazing. And you could do it for up to, I think 2 years postpartum. You don't have to. I mean, my last shot, I think I did it for about a year almost. Not consistently, like I probably did it consistent for the first 6 months, but then like after that, like I would do it and I'll forget about it. I would do it some more, forget about it, stuff like that. But like my first child, I probably belly bonded for like 4 months. So yeah, it just depends on your level of healing and how you feel comfortable. But it's amazing, and I think it's awesome for anyone who needs to address their posture, and which I just had to do because I was just slouching. But yeah, address your posture, heal, put those bones back into order, those organs, and yeah, just feel better and great, and pull that uterus back in, and get yourself back together. And yeah, and it's just an amazing practice. So I will see you guys for the next video. Thank you so much again. I'm Michelle, a full spectrum holistic doula at Birth Uhura. Peace and pregnancy dust.